Hello friends, today we are going to talk about a disease of the liver, that is hepatitis. It is quite a common disease. Hepatitis can be caused by many types of viruses, but the most common type of hepatitis that we see in day-to-day life is the hepatitis A, B and C. Let's talk about hepatitis A first. The hepatitis A is caused by a virus, and this is transmitted by the fecal-oral route. That is, it is usually seen in places and people who do not maintain hygiene or sanitation while eating and defecating. This type of hepatitis can present with a little bit of pain in the liver area. There may be nausea, vomiting, retching, and if the investigations are performed, there's a rise in bilirubin level many times, and the SGPT and SGOT, the enzymes of the liver, also rise very high in type hepatitis A. Alkaline phosphatase may be borderline raised because of some elements of obstruction, and this can sometimes become to this extent that the disease might take around 15 days to 1 month, and this is a self-limiting disease basically. We just have to give supportive measures, that is rest and diet restriction in the form of giving only carbohydrates and no fats or proteins in the diet. This is the commonest type of hepatitis which is seen, and the second type of hepatitis, that is the hepatitis B, is usually transmitted by contamination of blood and body fluids. That is sometimes by the people sharing common syringes with people who have hepatitis B, and also the mode of transmission can be sexually transmitted, that is admixture of the body fluids, and the symptoms are quite similar. Other than this, there might be a rise in bilirubin, but not to that extent as seen in hepatitis A. The SGOT and the SGPT also rise. The most common complication that can occur in this type of hepatitis is that the surface antigen antibody, that is the hepatitis B antibody, HBsAg, might remain positive, and usually it reverts back to normal or becomes negative in 3 months. But in some patients, we see that this persists, and such patients can become chronic carriers of hepatitis B. There may be complications like fibrosis or leading to cirrhosis and also liver carcinoma. The investigations are quite similar. Other than this, the antibodies, that is, I have already told you about the HBsAg antibody, and can be performed to know which type of hepatitis is there in the patient. The third type of hepatitis, the hepatitis C, the mode of transmission is again quite similar to hepatitis B, that is by the blood and the body fluids, but this disease, though it appears quite simple, but sometimes can be cured by the immunotherapy or sometimes by giving the supporting measures along with the immunotherapy. But if it becomes chronic and hepatitis C antigen that remains in the body, then such people will remain positive for hepatitis C antigen for a very long time or sometimes even lifelong. The immunizations are available against the hepatitis A and hepatitis B. Hence, all healthcare individuals should take immunization for hepatitis B and keep their titers in proper condition so as to prevent the disease from being transmitted from patients who are hepatitis B positive. And if diagnosed in time, the investigations, basically that we do in all the 3 types of hepatitis are the serum bilirubin, which rises many times in hepatitis A. It rises in hepatitis B also, but not to that extent as seen as hepatitis A. And even in hepatitis C, where sometimes even borderline bilirubin might be raised. The SGPT and the SGOT levels, they rise many times in hepatitis A, but revert back to normal in a short span, that is, say, 15 days or month, and completely come back to normal in 3 months. While in hepatitis B, sometimes the antibody, that is the HBsAg, remains positive, And such patients, even after say a month or even 2 months or sometimes lifelong, such patients are then known as the carriers of hepatitis B. And the complications that might occur in such patients may be like fibrosis, because the liver heals itself by means of fibrosis. Then there can be cirrhosis or sometimes carcinoma of liver even. And hepatitis C is also quite a difficult disease, because the mode of treatment is only the immunotherapy and the supportive measures. And if it remains positive for a very long time, then it becomes chronic and can again lead to complications. All the healthcare individuals must take immunization against the hepatitis B and also hepatitis A, especially in children and young adults, so as to prevent the disease from becoming very fulminant and causing complications. Thank you so much.